Curry College has been providing a rich blend of liberal arts and career-directed degree programs since 1879. One of these programs is an accelerated nursing degree. Curry College's Dean of Nursing, Michelle McMahon, stopped by the studio to talk with Julie Thompson about this vitally important program and what nursing students can expect from the Curry College experience.
I am so pleased to welcome today Michelle McMahon, who is the Dean of the School of Nursing at the Curry College Plymouth campus. Welcome.
Thank you. Thank you for having me.
Thank you for being here. Now, to be the Dean of the School of Nursing, you must have some very high-level pedigree. So can you just tell us a little bit about your personal background and how you got to where you are right now?
Yes, of course. So I've been a nurse for 32 years, and I originally was a practicing nurse, worked in Boston for several years, and always knew I wanted to teach. I kind of was that person that all the new nurses, when they came to the floor, I wanted to make sure that, they could work with me and I could orient them. So I pretty quickly went back and decided I wanted to get my master's degree and continue on that academic nursing path. I taught practical nursing for several years, and then I did my student teaching during my master's program at Curry College, and I really enjoyed it. And when I got my master's degree, I applied for a position there, and that was in 2008, and I have been on the faculty there since that time.
Wow.
I continued on to work in academic nursing. Full-time, you really need to have a doctorate degree, so I immediately went back and entered into my PhD program, which I finished and have stayed on the faculty at Curry since '08. And then, very fortunately, I was able to kind of grow as a leader there. When opportunities came up, I was the graduate MSN program director for 4 years, and then the opportunity came up where our dean was retiring and the position was posted, and it was really something that the timing was just right, and my commitment to the college was there.
Perfect.
Yeah.
So, quick question. When you're a teacher, an administrator in nursing, do you still have to have X amount of practicum hours actually nursing every year?
Yeah, so I actually don't practice as a nurse currently. Over time, I think you do. A lot of people continue to work on their off time or during the summers, but my role now is a year-round position. So I really don't have additional time to do some per diem work, but many of our faculty do. They work, they do weekend shifts, and especially those who have nurse practitioner licenses, they have hours that they have to maintain.
Got it.
So me personally, my balance is more on the administrative side and scholarship.
And I'm sure that keeps you quite busy.
Absolutely, yes.
Now, something really unique about your campus here in Plymouth is a new lab that you've why don't you tell us all about what this is and what makes this so special?
Absolutely. So we are so proud. We very recently, this January, launched our Nursing Simulation and Training Center. It is a state-of-the-art, beautiful sim center, and it has, it's really designed like a hospital with a unit that has 5 individual rooms with simulation mannequins and high-fidelity sim. We also have a centralized nurses station, and everything has the technologies to allow for cameras and being able to audio back and forth from the rooms. So we're able to have multi-patient simulations and students in various areas and really interacting like simulation should, as if it was a mock experience that was very realistic and authentic.
Which must be just so unique for a student to be able to, instead you're reading books and you're hearing lectures and you're studying things, but to actually have the hands-on in an environment. And before we went on the air, I said that was like a movie set. It's set up like or a TV set that takes place in a hospital.
Absolutely.
So that you can, now, when you say you have cameras, you actually film the students doing their work?
We do. That's part of the simulation experience, is to tape or record or live stream sometimes, depends, and we will actually do that, and it's part of the educational purposes, so we do it. And then the most important part of simulation, and we continue after every time we have a case, so we run a scenario, we have a debriefing. And the debriefing is really where the learning occurs.
Sure.
So we have two ways to use the audio and the video that is obtained. We either can have students view it back and we talk about critical points and decision points and what were they thinking at the time, or sometimes we use it where we have some students in the room running a sim and we have a debriefing room where there's people watching in live time and they are able then to participate even though hands-on, not in the room.
Right.
Yeah.
Wow. Incredible. Now, do most colleges do this?
Yeah, actually, School of Nursing have really come a long way. Simulation has grown exponentially. I would say probably in the last 10 years.
Yeah.
Most schools do have some level of lab. We also have a sim lab at our Milton campus.
Yep.
I would say that our Plymouth campus, being that it was just built with all the most up-to-date equipment is really it's really significant. It's top of the line. It's great. It's a great opportunity to have not only for our students who are there, and I should say we also have a high fidelity sim room which has a control center, so we can really run some, pretty significant high tech. Where there's an operator who's behind glass and students are we're able to change the physiology of the mannequin and really make the scenario different things depending upon student decisions. So it's quite significant.
Now, do you do anything like there was a multi-vehicle accident coming in, or do you plan for disastrous type events too?
Yeah, we have all kinds of scenarios. We're growing them all the time. So sure, something like that, a trauma, MVA trauma, things like we have ICU critical events.
Yeah.
A patient becomes septic, gets a sepsis or something to that effect. We have all kinds of cardiovascular types of events, and we have all the monitoring equipment in the room so they can actually see the rhythms change, and we can change things in live time.
So they not only are medically doing what they need to do medically for the patient, but you're seeing how their reactions are, how they interact with each other, how quickly they can think on their feet, which must be one of the most valuable things as educators.
I mean, you said it right. That's absolutely the most important part of the simulation. It's not so much the task, the physical touching of things.
Right.
It's more the thinking and understanding the rationale for why they're doing the things they're doing.
Right.
So yeah, you're absolutely right. And one of the other very valuable things you mentioned is the whole teamwork and collaboration and understanding what it might be like when they are practicing nurses to have that interactions and how they take leads in certain times, how they're able to assist and collaborate. So all of that is the very important part of learning.
When to know to call for help?
Yeah,
when you don't have the
when
answers?
When to call for help, absolutely.
Right. So to go into nursing now, you must have a huge, diverse population that now is signing up to be nurses for the first time.
Oh, absolutely. And across our programs, we have a traditional program with, more typical from high school students, but then we have a lot of continuing ed and graduate studies. And so those are our adult learners. And they come at various points throughout their careers. As I mentioned, some of our students are coming to be nurses for the first time, but they have had careers in other areas.
Right.
They have a bachelor's degree in business, or they've been an English teacher and they've always wanted to be a nurse. And so we're seeing a lot of second career changers coming back and seeing nursing as a profession that has such great opportunities and something that has always been of interest to them. So that we also have a huge population of nurses who come back to continue their education. Because nursing is all about continuing your education. You can, when you graduate, you always have to go back and learn new things. So we have an RN to BS, a registered nurse to baccalaureate program for nurses who enter practice with their associate degrees. And they're working and experienced nurses, and they come back and they get their bachelor's degree.
Good for them.
Yeah, absolutely. And we have nurses who have the bachelor's degree who are working to be nurse leaders in their agencies. So they come back and do our graduate level Masters of Science in Nursing. And we have 2 tracks. One is in nursing administration, so
Yep.
people who prefer that route, they
Yep.
want to be nurse managers or lead quality safety teams.
Sure.
Or nurse educators, people who want to teach the
Yeah,
next generation of
right.
nurses.
And my final question is placement. So once people graduate, there's a million different places nurses can work now.
Absolutely.
And all kinds of different shifts. And so talk a little bit about the placement of your graduates.
Oh yeah, well we have all of our students who graduate for the first time being nurses. They then of course are eligible to sit for that NCLEX, which is that nursing licensure.
Yep.
And once they receive that, they work everywhere. Many of them probably go to acute care facilities, but we're seeing more and more students, community settings, hospice,
Yep.
Ambulatory care settings. There are so many opportunities right now for nurses. I'm sure you know that we have a nursing shortage, and we will continue to have one.
Right.
So
you'll always be able to get a job.
you will always get a job, but you will always have like an enrichment, and you can always be challenged with a new area. And it's just so flexible as a profession because you can do so many things.
Right.
You can work in a school with children. You can work in an acute care facility. You can work any shift, right? You could work overnights only, or just do weekends.
Whatever works
it's
for you
very
and your family.
flexible.
Which is wonderful. And the very last thing, and this is more on a personal note, as someone who was a nurse and has years and years of experience in it, do you often get asked, "Oh, I have this," or "This is happening," or "My father does this. What should I do?" Does that happen a lot?
That happens a lot, but I would say it happens less now that I've had more of a desk administration job. Now I say you should ask someone who's been in the clinical area.
Well, congratulations. Great about your simulation lab and training center. This is wonderful. Curry College has been around for a lot of years. I remember when it was just in Milton, and I have a few friends that graduated from that way back when.
That's great.
Great school, and thank you so much for joining us today.
All right, thank you for having me.
Thank you. Visit the college's website at curry.edu to take the next step in your education, or just learn more about what Curry College has to offer.
If you've enjoyed this video by The Local Scene, please give it a thumbs up and hit the subscribe button. Thank you for watching.